Are you needing a pelvic floor physical therapist that you can relate to, or that shows you that she cares about you? I'm Dr. Athena with Tele-PT, and I am exactly a compassionate, caring pelvic floor physical therapist. I have 3 reasons why you should choose me. Number 1, that I consider all of your health, not just your pelvic floor health. Everything is so connected. So, for example, I will ask you about your mental health, your social health, how often you're going out with friends or with family. I ask you about your physical health, not just your pelvic floor health, but overall health, past medical health conditions and medications. And I also ask you about your spiritual health. Do you believe in a higher power, and how frequently are you praying or accessing that power, and are you thinking about it and applying those things in your life on a daily basis? All of those things influence the pelvic floor. So it's great for me to get a big, wide picture of your overall health before I start treating you in telehealth. Secondly, what I typically prefer is an in-person evaluation. So hopefully you live around in the Omaha, Nebraska area. And in this area, it's very broad. There's Council Bluffs, Iowa. I have a patient in rural Iowa that drove to me, and I evaluated her, and I am able to do that in person and then determine whether or not our treatment would be best as in telehealth, or if not, I would refer them to another pelvic floor physical therapist. This is a third reason why you should consider hiring Tele-PT pelvic floor physical therapy, and that is that I am more or less a life coach. I have a lot of experience setting goals that are achievable with my patients, goals that will help them improve their mental health and their gut health, which are completely related with one another. And so we talk about those goals. Frequently, we set short-term goals, and those goals are SMART. In other words, they're specific, they're measurable, achievable, reasonable, and there's some sort of time limit to them. In other words, we can determine, okay, in 3 weeks, we're hoping for diaphragmatic breathing use to be up to 20% of the day, for example. When we have to make dietary changes to help heal the gut, I do not go in there guns blazing, ready to revolutionize someone's diet. Okay, I am 100% asking, what do you enjoy? What are your favorite things? Maybe we could discover new favorite things together. And that is my strategy. I want my therapy to be long lasting. I don't want therapy that's just going to last as long as we see each other. I want it to be something that my patient is convinced is the best for them. Another reason why you should hire me as Tele-PT pelvic floor physical therapy, Dr. Athena, is so that we can not only make the treatment last longer, but let it be practical for you. So I don't prescribe 10 or 15 minutes of extra pelvic floor exercises. What I do is I get to know you and your regular activity patterns. And so for example, I have a patient who likes to go on a morning walk with their dog, and it's only like about 20 or 30 minutes walk, but during that time I have him work on his diaphragmatic breathing and pelvic floor strengthening during the walk. So that might look like some slow breathing, and in the exhale, some contracting of the pelvic floor and the transverse abdominis. I also instruct people on how to use their pelvic floor in their daily life. So when they're reaching over or leaning down or picking something up from the ground or squatting, I help them discover ways that they can apply what we've been learning to their everyday. I want pelvic floor strength to happen. I want pelvic floor strength to happen naturally, and not as an exception, but as the day-to-day work. Because what's happened in our bodies, I believe, in our culture, is that we've become very sedentary, and obviously more sedentary than we used to be 200 years ago, most likely. And so our brains are really great about making everything very efficient. And if the brain doesn't see that there is any need to involve the pelvic floor or some of the abdominal muscles in our work, then it will shut it off. And what my instruction, education, encouragement of my patients is to turn it back on and to use it all the time. Our muscles get strong in every way when we use it in our daily life. So those are 5 reasons, handful, I said 3, but I did 5 reasons that you can hire me, you should hire me as Tele-PT Pelvic Floor Physical Therapy. I'm Dr. Athena, and I'm happy to serve you for your pelvic floor physical therapy needs. I am very compassionate. I'm very great at considering all the different aspects of your health: social, mental, physical, and spiritual health. I consider all of your medications, and I'm more or less a life coach because I meet you where you're at. I set reasonable, smart goals with you and that are practical. I don't occupy more than the time of our appointments typically. Just a moment here, because the exercises that I encourage are practical or exercises that you can do every single day. I really I use the interview process. I get to know the activity of my patients. For example, one of my moms, she has a couple of very large dogs, and they have a laminate floor, and every time those dogs jump up on the sofa, the sofa slides. And so one of her chores that she has to do on a daily basis is push that couch back into place. And so she told me that, and I said, okay, perfect. Every time you're pushing back that couch, instead of like taking a deep breath and kind of bearing down, I want you to release all of the air, contract your pelvic floor and your abdominal muscles, and push that couch back into place. Every time you pick up your year-old baby, I want you to do the same thing. I want you to engage the pelvic floor to support your low back and decrease the strain there. I have some patients that have experienced low back pain in the past, and it has a lot to do with the fact that they are not engaging the full musculature that they have available to them. We have not just muscles in our low back to support our entire upper body. We have muscles in the front too, the abdominal muscles. You don't have to be skinny to use your abdominal muscles or your pelvic floor muscles. You can engage them and use them and support your upper body with your low back. And that teamwork it can happen all day, every day. And I talk and counsel with my patients so that they can figure that out, what that looks like for them, not occupying their time with any extra workouts that they have to do. So if you would like me to treat you for pelvic floor physical therapy, please click the link in my description, and there it'll take you to my booking site. It's a simple process to book your initial phone call. It's free. We'll talk on the phone. I'll talk to you about my prices, insurance if you have it, health savings accounts if you have them, and we'll book an appointment that is easy and convenient for you. I hope to see you, or I hope to talk with you soon. Thanks. Bye.